halve the proportions of people with sustainable access to safe drinking water and sanitation. In the year 2001, development in cooperation with pharmaceutical companies provide access to affordable essential drugs in developing countries. In the year 2015, then comparative advantage. Neutral organization to all member states, nearly universal membership, global presence and networking. No parallel organization in tackling disease. Large number of expertise in all health issues, strong coordinations and convincing activity ability, strong fund collecting ability, global cooperations, collaborations and investment. Then major challenge. Invest Investing in health to reduce poverty, building individual and global health security, promoting universal coverage, gender equality and health-related human rights, tackling the determinant of health, strengthening health system of equitable access, harnessing knowledge, science and technology, strengthening governance, leadership and accountability, emerging health problems. Thanks. So I have finished my part, so I hand over my friend Emmanuel.
हेलो इमरान हेलो इमरान
तो उसका साउंड डिस्कनेक्ट हो रहा है तो उसका साउंड नहीं दिखा रहा है हेलो इमरान आई मैसेज कर रहा हूँ व्हाट्सएप में Imranul, okay. Start Imranul. मेरी ना
यस
मतलब वो उसका साउंड आई थिंक नेटवर्क इशू हो रहा है मैं बोल दूंगा ठीक है वो पार्ट ठीक है वो मतलब कंटिन्यू करो ओके
ओके ओके
okay role of WHO in the coronavirus pandemic okay so all of you heard about coronavirus because coronavirus killed so many people okay and now handling COVID-19 pandemic मेरी ना okay the World Health Organization has been at the heart of the battle against the new coronavirus since the first report outbreak in China as the WHO World Health Assembly gathers on Monday to plot the path ahead. Here is a timeline covering the key movement in the WHO. WHO's widely contested handling of the COVID-19 pandemic. Okay, so unknown causes. December 31, 2019, China reported to the WHO cluster of pneumonia cases, okay, of unknown cause, मतलब causes मतलब unknown था उस time, ठीक है, in the city of Wuhan, the capital of Hubei province, of a total of 44 cases. 11 patients were several ill, while the other was stable, okay, मतलब 11 केसेस बहुत सिवियर था और other केसेस स्टेबल था, मतलब फर्स्टली कोरोना वायरस मतलब वो फाइंड आउट नहीं किया, पहले उसको बोला कि निमोनिया केसेस है, ठीक है, ओके। जनवरी 1 2020 द WHO activated crisis group, putting the body on an emergency footing for dealing with the outbreak, okay। January 4, January, this is January 1, okay, January 4, the WHO on social media reported a cluster of pneumonia cases with no death in one. A day later, it published its first disease outbreak news, uh, destined for scientists and public health specialists on the new virus. Okay, Marina. Okay, China gives WHO genetic sequence, मतलब ऑल वायरस, वायरस, मतलब हम लोग को क्या होता है, मतलब हम लोग को एक इम्यून सिस्टम होता है, लाइक ओके, हम लोग इम्यून सिस्टम क्या करता है कि मतलब माइक्रो बैक्टीरिया वायरस से हम लोग प्रोटेक्ट करता है ना इम्यून सिस्टम, ओके। सो वायरस को भी क्या होता है कि मतलब इम्यून सिस्टम नहीं है, लेकिन एज ए इम्यून सिस्टम वर्क करता है, क्या होता है, प्रोटीन कोड, ओके। प्रोटीन कोड होता है जो मतलब वो उसको ब्रेक करके ही हम लोग क्या कर सकते हैं, कोरोना वायरस को हम लोग को वैक्सीन मेडिसिन मतलब उसको किल कर सकता है, ठीक है। उसको जो प्रोटीन कोट होता है वो
कोरोना
मतलब एक्ट एज अ इम्यून सिस्टम, ओके। तो मतलब एक उसको मतलब नहीं मेरे ना मतलब ओके, यानी देन जेनेटिक सीक्वेंस उसको मतलब फाइंड आउट करना पड़ता है पहले, ओके। सो चाइना गिव्स WHO जेनेटिक सीक्वेंस, ओके। जनवरी 10 द WHO सेंट टेक्निकल गाइडेंस with advice to all countries on how to detect, test, and manage potential cases. Okay, give genetic sequence. Okay, evidence at the time suggested no or limited human to human transmission. The WHO said. Okay,
Hello, I'm
मतलब
sorry to
WHO
say
ने
that
बोला कि
net problem was too ज़्यादा.
इमरानुल, इमरानुल शायद इमरानुल बोल रहा है, आई थिंक। हेलो,
Sandeep, since he's a problem, you continue because we are running short of time now.
ओके 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 ओके। January 11, okay, China gave the WHO the genetic sequence of COVID-19. January 13, Thailand report the first imported case on its territory. Okay, so all Mirina, next slide. Virus have a protein code. We need to break that protein code. Okay, then reports of limited human to human transmission. January 14, Maria Van Hope, the WHO COVID-19 technical lead, told a news briefing that there may have been limited human to human transmission based on 41 confirmed cases, and that there was the risk of transmission, a wider outbreak. Okay, then January 2021, WHO experts from China and the Western Pacific region, okay, went on a brief field visit to Wuhan, January 22. The WHO mission to China said there was evidence of human to human transmission in Wuhan, okay, among close contact such as families or in the healthcare setting, but that more investigation was need to understand the full extent of transmission, मतलब हम लोग और मोर इन्वेस्टिगेशन करना पड़ेगा, ठीक है। एपिडेमियोलॉजी पार्ट, इट इज इम्पोर्टेंट। एपिडेमियोलॉजी क्या करता है, इन्वेस्टिगेशन करता है कितना पीपल अफेक्ट हुआ है, मतलब और किस तरह से वो ट्रांसमिट हो रहा है, ठीक है, एपिडेमियोलॉजी पार्ट, ओके। देन WHO डिक्लेयर COVID-19 टू बी अ पब्लिक हेल्थ इमरजेंसी, ओके। मेरे ना जस्ट ओके, मतलब अभी क्या किया, मतलब वो कोरोना वायरस पब्लिक हेल्थ इमरजेंसी डिक्लेयर किया। जनवरी 22-23 WHO चीफ टेड्रोस एडनोम Ghebreyesus, sorry, I cannot pronounce, convened an emergency committee to assess where the outbreak constitute. Okay, a public health emergency of international concern. Okay, the highest alert it can trigger. The committee consisting of independent international expert was unable to reach consensus and asked to meet again 10 days later. Okay, January 28th, a WHO delegation traveled to Beijing. Okay, led by Tedros, who agree with the China government, and international team of scientists would be dispatched to China. Okay, January 30, the WHO declared COVID-19 to be a public health emergency of international concern. Right? Then Italy emergency as the new epicenter. Italy emerged as a Italy emerges as the new epicenter. Okay, Italy emerged as a new epicenter of February 1624. An international scientific mission of experts from the United States, China, Germany, Japan, okay, South Korea, Nigeria, Russia, Singapore, and Canada travel to Wuhan. Okay, February 24. A team of experts from the WHO and the Europe Center for Disease Prevention and Control uh, travel to Italy, which become the epicenter of the coronavirus outbreak after China. You know, all of you know Italy, मतलब इटाली में so many people ना मतलब died from coronavirus. इटाली में बहुत ज़्यादा people मर गया था, ठीक है, बाद में चाइना के बाद में. March 11, the WHO designed COVID-19 as a pandemic. Okay, at the time, 90% of cases were declared in just 4 countries. Okay, according to the WHO, with 81 countries reporting no case at all, and 57 countries reporting up to 10 cases. Okay, Elena? Okay, Trump halts payment to the WHO. April 9. Okay, the WHO published a chronology of its statements in response to criticism that had been slow to sound the alarm. Okay, April 14, US President Donald Trump halts payments to the WHO pending a review of its role in uh, allegedly severely mismanaging and covering up the spread of the coronavirus, and uh, excuse it of being based towards China. April 24, the WHO urged member states to speed up the development, production, and distribution of treatment and vaccine and ensure universal access to the refugees. Okay, virus. The next, virus may never go away. Okay, April 27. The WHO urged countries lifting their lockdown measure to test. Okay, isolate and treat suspected cases while ensure